This is Breaking News.
And good morning to you. I'm Chris Wragge. New York Governor Andrew Cuomo giving a briefing right now in Albany on the coronavirus outbreak. Let's listen.
Health Commissioner Dr. Zucker, Melissa DeRosa, Secretary to the Governor, Robert Mujica, Budget Director. Let me go through an update. As you know, this situation changes daily now, which is expected. This is an evolving situation. Numbers ramp up. That's been the experience in every country that this has visited. So we want to make sure that you understand that as the facts change, our strategy changes, right? We have a plan. We're sticking with the plan. The plan adjusts or moves as the facts move. First stage was always testing. The testing is now, first step was testing and second step was containment, and they work together. The testing has ramped up. It's continuing to ramp up. It will be in the thousands per day. That is going very, very well. The state is managing its testing capacity. We're working with the federal government on bringing on automated testing. That is all going very, very well, and the numbers are going up. Containment, we've taken a number of measures, significant measures to do containment, and that is working very well. On the containment side, we had a tri-state strategy, which is highly unusual, but highly effective. We worked with Connecticut and New Jersey, and we announced the same rules, Connecticut, New Jersey, New York. Why? You don't want people shopping different states because different states have different rules. You don't want people driving to Connecticut or New York or New Jersey because there's a different set of rules. So uniformity works. It's hard to do, but when you can do it, uniformity works. And we did that yesterday with restaurants, bars, gyms, all closing 8 o'clock last night and staying closed today, with the caveat that they could sell off premises by delivery, and the State Liquor Authority changed their rules to make that possible. We closed all schools. All schools are closed for a period of 2 weeks. And the 180-day SED requirement is waived for 2 weeks. At the end of 2 weeks, we may renew that period of time, but all schools have the same period. Why? Because once again, you need uniformity. You don't want a business having some employees in one school district that is open and one school district is closed. So in all this disruption and all this change, try to keep it as uniform as possible and the rules as uniform as possible, so to the extent businesses can operate, people can live their lives, keep it uniform. My phone has been ringing off the hook with a number of local officials saying people are very, very upset. Who's upset about the gym being closed? Who's upset about their restaurant is closed? Who's upset about the bar is closed? Actually, I've had the highest number of calls being complained about bars being closed. I don't know if that is statistically representative of anything, but that's just anecdotal. Some people are upset about schools being closed. I said to the local officials, and I want to say to the people of the state of New York, if you are upset by what we have done, be upset at me. County executive did not do this. The village mayor did not do this. The city mayor did not make these decisions. I made these decisions. These were all state-ordered rules. It's not your local elected official. I made them because I believe they are in the best interest of the state. I know they cause disruption. I know people are upset. I know businesses will be hurt by this. I don't feel good about that. I feel very bad about that because I know we're going to have to then deal with that issue as soon as this immediate public health issue is over. But my judgment is do whatever is necessary to contain this virus, and then we will manage the consequences afterwards. The old expression, the buck stops on my desk, the buck stops on my desk. Your local mayor did not close your restaurants, your bars, your gyms, or your schools. I did. I assume full responsibility. Again, these are all statewide rules because we don't want people shopping among different jurisdictions. You close the bars in New York City, but you keep them open in Nassau. All you'd see is a flood of cars going to the bars in Nassau. So the uniformity is important. It's also important that no local government puts any rules in place without first checking with the Department of Health, so the Department of Health can make sure that they are consistent with all other rules that we are about to put in place. Mitigation is continuing and is ramping up. There are many rumors out there, part of the fear, the anxiety. People spread rumors. Well, maybe you're going to quarantine New York City. We hear New York City is going to quarantine itself. That is not true. That cannot happen. It cannot happen legally. No city in the state can quarantine itself without state approval. And I have no interest whatsoever and no plan whatsoever to quarantine any city. Well, you contained New Rochelle. We did a containment zone on New Rochelle, which was actually misunderstood. Nobody was contained in New Rochelle. There was no cordon around New Rochelle. You could come and go in New Rochelle as you wanted. The containment referred to the virus. All we did in New Rochelle was close the schools and close places of large gatherings. So nobody was contained within New Rochelle, and nobody's going to be contained in any city in the state. So that's a deep breath moment. And the last part of the strategy is dealing with the health care system. And this is where we are now going to shift our emphasis. And I want people to understand what we're going to have to do with the healthcare system, because that is now our top priority. And remember what we've been saying all along. There is a curve. Everyone's talked about the curve. Everyone's talked about the height and the speed of the curve and flattening the curve. I've said that curve is going to turn into a wave, and the wave is going to crash on the hospital system. I've said that from day one, because that's what the numbers would dictate. And this is about numbers, and this is about facts. This is not about prophecies or science fiction movies. We have months and months of data as to how this virus operates. You can go back to China. That's now 5-6 months of experience. So just project from what you know. You don't have to guess. We have 53,000 hospital beds in the state of New York. We have 3,000 ICU beds. Right now, the hospitalization rate is running between 15% and 19%. From our sample of the tests we take. We have 19.5 million people in the state of New York. We have spent much time with many experts projecting what the virus could actually do. Going back, getting the China numbers, the South Korea numbers, the Italy numbers, looking at our rate of spread, because we're trying to determine what is the apex of that curve, what is the consequence, so we can match it to the capacity of the healthcare system. Match it to the capacity of the healthcare system. That is the entire exercise. The quote-unquote experts, and by the way, there are no phenomenal experts in this area. They're all using the same data that the virus has shown over the past few months in other countries, but they're extrapolating from that data. The expected peak is around 45 days. That can be plus or minus, depending on what we do. They are expecting as many as 55,000 to 110,000 hospital beds will be needed at that point. That, my friends, is the problem that we have been talking about since we began this exercise. You take the 55,000 to 110,000 hospital beds, you compare it to a capacity of 53,000 beds, and you understand the challenge. As many as 18,000 to 37,000 ICU beds, okay? An ICU bed is different than a hospital bed. An ICU bed has additional equipment, most notably ventilators, and that's why you hear on the news ventilators are very hard to get globally. Why ventilators? Because we're all talking about acutely ill, mainly senior citizens who have an underlying illness. They have emphysema. They're battling cancer. They have heart disease. And then they get pneumonia on top of that. That's the coronavirus. They need to be intubated. They need an ICU bed. And that's the challenge. And that remains the challenge. And the numbers are daunting. What are we doing? Everything we can. First, flatten the curve. Continue to flatten the curve so you reduce that peak demand. We announced dramatic closings yesterday to reduce the density. It's possible we will be doing more dramatic closings. Not today, but I'm talking to the other governors in the other states, showing that expected flow into the hospitals. It's clear we can't manage that flow. How can you reduce the flow? You reduce the spread. How do you reduce the spread? You close down more interaction among people. How do you close down more interaction? Well, yesterday we closed the bars, the gyms, et cetera. You would continue to close down things such as businesses. Italy got to the point where the only things they left open were grocery stores and pharmacies. Those are essential services, but they closed down everything else. We're not there yet, but I am telling you, we have to get down that rate of spread. Because whatever we do on the hospital side, we cannot accommodate the numbers that demand on the hospital system. So again, we just enacted rules yesterday. We're not enacting any other rules today, but it is very possible because the numbers, as you'll see in a moment, are still going up. Whatever rules we come up with will be statewide rules. Hopefully, it could be done with our surrounding states, because the best way to do this is uniformity, no shopping, among states, among cities, among counties. Everybody lives with the same rules, so we don't have people on the road going back and forth trying to game the system. At the same time that you're trying to reduce the numbers coming into the hospitals, you're trying to increase the capacity of the hospitals. How do you do that? The hospital surge capacity. What is the surge capacity? Getting the existing hospitals to hold more people. Right now, there are rules and regulations about how many people can be in a hospital, how many people per room, how many square feet per bed, et cetera. That's for normal operating conditions. These are not normal operating conditions. We're examining the entire hospital system. What is the maximum capacity per hospital? if Department of Health waives their spatial rules, how many people can you get into hospitals? There is a meeting today with all the hospital administrators that I've asked Michael Dowling and Ken Rasky to run. Michael Dowling is a former Deputy Secretary of Health and Human Services, former Health Commissioner. Michael Dowling worked for my father as a Health Commissioner. I've known him 30 years. He's extraordinary. Ken Rasky, the same, represents all the hospitals, sitting down with the hospitals saying, change your headset. This is not about how you normally do business. Frankly, forget the economics. What's the maximum number of people we can get into your hospital? And what do you need to do that? And what equipment do you need to do that? And what staff do you need to do that? We're going back to retired staff, and we're asking them to contact us at this website, health.ny.gov/assistance, to get former nurses, former doctors to sign up to be on call. We're also going to medical schools, nursing schools, to try to get additional medical personnel. And then we're talking about temporary construction of medical facilities. Obviously, when you're talking about 45 days, you have a limited capacity of what you can actually get done. But I'm working with governments and organizations all across the state right now. How do we set up temporary hospital facilities? Even if they're not intensive care units, you can take people who are in the hospital beds, move them into a temporary medical care facility, and then backfill the bed. We're also working with FEMA, the Army Corps of Engineers, and the National Guard and the building trades unions to help us on this issue. The numbers, total people tested to date, we're up to 10,000 people, which is obviously exponentially higher than it was, and it's continuing to grow. Positive cases up to 1,300, new positive 432. Number of counties with cases continues to grow. Clinton County, Rensselaer County have been added to that. Our cases are, again, #1 in the nation. Our number of deaths now up to 12. 264 out of the cases are hospitalized. That's a hospitalization rate of 19%. That's higher than the normative hospitalization rate, which is at about 15%, but the 19% is higher. Again, keep this all in focus with what we know, the facts we know of what this disease does and what the impact is, which is the Johns Hopkins study, which has tracked every case since China. A couple of other points, and then we'll take your questions. We'll open today in Nassau County a drive-through testing office. We opened one in New Rochelle. It worked very well. We'll open Nassau today. We're going to open a Suffolk drive-through testing office, and we're going to open a Staten Island drive-through testing office. We're going to send up the paid family leave bill to the legislature today. I believe we have a three-way agreement on that. It will also have a provision to cover all people who are quarantined, and we will be doing that also. We'll also be opening a Rockland drive-through testing facility. Two other points. One, this is an extraordinary time in this nation's history. It will go down in the history books as one of those moments of true crisis and confusion and chaos. I lived through 9/11. I remember the fear and the panic that existed in 9/11, where a single moment, your whole concept of life and society can be shaken, where you need to see government perform at its best, you need to see people at their best. Everybody's afraid, everybody's nervous. How you respond, how you act. This is a character test for all of us individually. It's a character test for us collectively as a society. What did you do at that moment when all around you lost their head? Right? Rudyard Kipling. That is this moment. What does government do in this moment? It steps up, it performs, it does what it's supposed to do. It does it better than it's ever done it before. What does government not do? It does not engage in politics or partisanship. Even if you are in the midst of an election season, even if you are at a moment in time in history where you have hyper-partisanship, which we now have, the President of the United States, Donald Trump, it is essential that the federal government works with this state and that this state works with the federal government. We cannot do this on our own. I've built airports, I've built bridges. We have made this government do things that it's never done before. This government has done somersaults. It's performed better than ever before. I am telling you, this government cannot meet this crisis without the resources and capacity of the federal government. I spoke to the President this morning again. He is ready, willing, and able to help. I've been speaking with members of his staff late last night, early this morning. We need their help, especially on the hospital capacity issue. We need FEMA. FEMA has tremendous resources. When I was at HUD, I worked with FEMA. I know what they can do. I know what the Army Corps of Engineers can do. They have a capacity that we simply do not have. I said to the President, who is a New Yorker, who I've known for many, many years, I put my hand out in partnership. I want to work together 100%. I need your help. I want your help. And New Yorkers will do everything they can to be good partners with the federal government. I think the President was 100% sincere in saying that he wanted to work together in partnership, in a spirit of cooperation. I can tell you the actions he has taken evidence that. His team has been on it. I know a team when they're on it, and I know a team when they're not on it. His team is on it. They've been responsive late at night, early in the morning, and they've thus far been doing everything that they can do, and I want to say thank you, and I want to say that I appreciate it. And they will have nothing but cooperation and partnership from the state of New York. And we're not Democrats and we're not Republicans. We are Americans at the end of the day. That's who we are. And that's who we are when we are at our best. So this hypersensitivity about politics and reading every comment and wanting to pit one against the other, there's no time for this. The President is doing the right thing in offering to step up with New York, and I appreciate it. And New York will do the right thing in return. Also, on a personal level, this is, we use the word disruption. It's such a clinical, antiseptic word. It's a period of disruption. Life is turned upside down. It's just turned upside down. Remember those snow globes when you were a kid and you shook the globe and the snow went all over and the whole picture changed as soon as you picked up and shook that snow globe. Somebody picked up our country and just shook it. and turned it upside down, and it's all chaotic, and things are flying all over, and there's new information, and there's mixed information, and people don't know what to do, and businesses are closing, and the rules change every minute, and can I go out, can I not go out, how do I get the virus, how do I not get the virus? And now I'm at home, and I'm stuck at home, and the kids are at home. And then there's a whole component to this. Don't touch anyone. Don't hug. Don't kiss. We're human beings. That interaction is so important to us. That emotional affirmation is so important to us. And now you have all these weighty decisions. Should I go out? Should I not go out? Is this safe for my kids? Is this not safe for my kids? I'm stuck in my house. I've used my experience just as a metaphor to communicate and relate. Having the kids in the house. Sounds great, having the kids in the house. Yay, the kids are in the house. I remember when my kids were young, I was divorced. My kids were 3 girls. They were 6 and 7 and 8 years old. 6 and 7 and 8 years old in a small apartment in Manhattan. That's a lot of fun, and then that gets old very fast, right? The claustrophobia just sets in. Sets in for the kids, would set in for me. What I would do then is I would go to my mother and father's apartment, which was also in Manhattan, because it was to get out of my apartment. And I would go to my mother and father's apartment. They had a little apartment in Manhattan. And my mother was magic with the girls. And she would play with them, and she could play with them all day, my mother. My mother's pure sugar. She's just pure love, my mother. But I'd be there for a couple of hours, and I'd be sitting there with my father. We'd sit on the couch, and we'd watch a ball game. And after a couple of hours, now the kids are running around, and the kids are picking up this, and they're picking up this, and they're picking up his picture frame, and my father said, put that down, don't touch that, don't touch this. After a couple of hours, my father would say, I think you have to go to work now, pal. And I would say, no, Dad, I don't have to go to work. No, I think you have to go to work now, pal. You know, having all the kids in that tight environment, that's very stressful. That's why yesterday we said all the fees on all the parks are waived. Get out of the house, go to a state park. We have beautiful state parks. By the way, traffic is down. Put the kids in a car, go to a state park, go to a county park, go to City Park. Shirley Chisholm Park in Brooklyn is beautiful. It's open, it's air, the weather's getting better. Spend the time with the kids. There's also tension among families. I mentioned my mother, who is numerically a senior citizen, although not in her reality. I wanted her to stay home. I want her to be isolated. She's my mom. I want her protected. One of my siblings said, I want to take Mom to my house, and we're going to have a party at my house, and I want her to see the kids, etc. I said, that's a mistake. You shouldn't do that. You should let Mom stay home. I'm more protective. The sibling was saying, I want to take Mom. She wants to get out of the apartment, expose her to the kids. I said, you don't know. All you need is one kid. All day long, all I hear about is somebody coming up to me saying, I didn't know, but my daughter was with this person, blah, blah, blah. So I can even see the tensions in the families. And that's real, too. And people should expect that. And lastly, there is something to this lack of ability to connect. Don't hug, don't kiss, stay 6 feet away. We are emotional beings, and it is important for us, especially at times of fear, times of stress, to feel connected to someone, to feel comforted by someone. I mentioned my daughter. I haven't seen my daughter in over 2 weeks. It breaks my heart. breaks my heart. And then this concept of maybe I can't get next to her because of this virus. There's a distance between me and my daughter because of this virus. It saddens me to the core, and it frightens me to the core. And I had her on the phone this morning, and I said it to her. I just said it to her. I said, I can't tell you how hard this is for me, not to be able to be with you, not to be able to hold you in my arms, not to be able to kiss you all over your face, which she hates anyway. But and that plays out 1,000 different ways. You put all this together, it's a hard time. It is a hard time on every level. It is a frightening time on every level. At the same time, it is this much time. It is this much time. Is it 3 months? Is it 6 months? Is it 9 months? I don't know, but it's this much time. We will get through this much time. Understand what we're dealing with, understand the pressures that we're feeling, but we will get through this much time. Be a little bit more sensitive, understand the stress, understand the fear, be a little bit more loving, a little bit more compassionate, a little bit more comforting, a little bit more cooperative, and we will get through this time. We will lose people, yes, like we lose people every year with the flu. We're going to be challenged and tested. There's going to be periods of chaos, yes. We've been through that before also. But this is all we're talking about. And we will learn from it, and we will be better prepared the next time, because this is not the last time, my friends. This has been a growing rate of these emergencies and health situations and storms. But we're going to get through it, and we're going to get through it together. But understand the pressures that everyone is feeling. And let's be considerate of those feelings that are now collective and societal. That's my 2 cents. Any questions?
Governor, just a question of, it's peaking in 45 days. I was looking at my calendar. That's right around the presidential primary, April 28th. Are there thoughts to postponing the primary at this point?
I have virtually no political thoughts at this time, and no thought about postponing an election.
It's a health thing.
Yeah, I've not considered it. I haven't thought about it. I haven't had a discussion with anyone about it.
On the issue of mandatory quarantine, San Francisco Bay Area, 6 counties there have basically shut down. Some city officials in New York City have called for a similar action of sheltering in place in the city. Explain to us what your thinking on that is, why you're resistant to that, and whether that could change.
I am resistant to nothing. Whatever we do, we will do statewide. Ideally, whatever we do, we will do regionally with the other states. You take an action in one place, Jesse, that you don't take some at another place. You say to me in Nassau County, you have to shelter in place. I say, fine, I'm going to go stay with my brother in Westchester. That's what I say. You say, all of New York, you must shelter in place. I say, fine, I'll go stay with my cousin in New Jersey. That makes the situation worse, not better. So to the extent you can, come up with a policy, enforce it uniformly. What is the policy? Just yesterday, we took very, very dramatic steps, the bar, restaurant, schools. The curve is not flattening to a level that we can sustain, which would suggest that you're going to need to take more efforts to slow the curve. That's what we're exploring now. It is likely that we will take more efforts to reduce the spread by reducing the density. What are they? That's what we're considering. But there's a number of ways to do it. The quarantine suggests you are limiting somebody's movement to a geographic area. Unless you were to quarantine, all you would do is move people out of one place to another, right? Because there are people who just will panic at the thought of being quarantined. We're going to impose a quarantine in Albany City starting tomorrow at 6 p.m. You know what that means? Everybody gets out of Albany City and gets to another location. So, and there's ways, there are many, many steps before that. Before you go to limiting an individual's mobility, it's places of density and places that create density, like businesses, right? That's where you would go. You would reduce business operations beyond essential business operations. That would be the initial calibration, but we're not there yet either. But these are all the things we're talking about.
You've spoken many times about the importance of child care, particularly for essential workers. There are a lot of parents out there who are concerned about their daycare centers and wondering if those will close at some point. What would you say to them, and is that something the state's looking at?
I would ask Mr. Malatras, because that is a technical, smart, hard question.
Right now, most daycare centers remain open. They are to help limit density in specific rooms as required. And the governor, knowing especially first responders and our healthcare workers remain essential, we have the 4 downstate plans for school closures that take care of many of the daycare issues, which we'll be approving on a rolling basis. They came in last night. And then the governor recently directed the healthcare associations, Greater New York and Haney's, to develop a plan for drop-in daycare at some of the hospital locations to address some of these emerging issues. OCFS will be waiving many of the requirements or fastly expediting those issues to stand up a lot of these immediately. So limit density in many of those areas in daycare facilities to smaller groups, 10 or fewer, so they're bringing in more staff. And in other cases, we're standing up daycare or expanding daycare in areas where we have less need. For instance, many of the SUNY and CUNY campuses have not-for-profit daycare centers, given many students are not coming back, and those faculty members are non-essential employees basically working from home and doing distance. We are working with those daycare providers to provide daycare services for our first responders, healthcare workers, and others to meet some of those needs as well with less density. So we're limiting the density across the board.
Do you anticipate that some of these private daycare operators will shut down at some point?
We're working right now on the educational side with the Department of Health, Office of Children and Family Services to do it on a case-by-case basis. It depends on the size of the daycare, depends on if there's any positive cases. All of those things come into play. So when we've been working on the school closure plan, we've been working hand in glove to make sure we have more availability across the state, open up more opportunities by limiting the number of children in specific rooms, specific locations to meet those needs for parents all across the state.
Also, John, you have to remember when you're setting these policies, these things are all interconnected, right? Close the schools. Okay. How do the essential workers go to work the next day? Who's going to watch the kids? Oops, I didn't think about that. Close the daycare centers. Okay, then how do the people go to work who were leaving their children in daycare? Leave the businesses open, but close the daycare. Well, then how do you leave the business open if you close the daycare? So it all goes like this, right? That's why there is no such thing as a piecemeal, isolated strategy that works. It has to be comprehensive, and it has to be statewide. And the rumors of these things are not productive either. That's why I said to Jesse, quarantine in place. No place. First of all, no state, no locality in this state can take an action without state approval, right? If Albany City said quarantine in place, I wouldn't allow it. So whatever we do is going to be statewide, thought through, comprehensive. Nobody's going to be quarantined, If there are any additional actions, the likely additional actions would be on the business side first, right? Because before you do anything with daycare or anything else, you have to be home, right? So what businesses need to be operational now that are putting people in an office setting? If the first step would be reduction on the number of businesses. That then leaves parents home, that then allows children to be home, but that would be the normal calibration.
Should public libraries close? I know that it's been kind of left up to the local systems at this point, but that's also a place where...
That's also one of the things we're thinking about, and we'll have a decision on that.
Has there been an estimate of how many ventilators the state currently has, how many of those are available, and what the projection is for intubation use of the people at the hospital?
We do know we have around 4,000 ventilators, but part of the team that the governor put forth with Michael Dowling and Ken Rasky, we're going to sit down and discuss that going forward today.
4,000 ventilators that are
Across the state.
Or just
Well, there are more available than that, but that's the numbers that we have right now. We have a stockpile. There are ventilators there, but we're looking about getting more ventilators.
How many do we have in that stock?
We have hundreds and hundreds in the stockpile as well.
Yeah, but Josefa, your question is right. You are in the thousands. You're under 10,000. And you're right. The need could be much, much higher. And the complicating factor is you can't find a ventilator for sale. We're looking desperately. But China just bought all the ventilators, and then South Korea bought all the ventilators, and then Italy bought all the ventilators, and now Germany is buying all the ventilators, and now California is buying all the ventilators. So the main repository for ventilators is federal government.
So can the state, given your executive oversight, ask a company like Welsh Allen or any other medical supply company in New York to cease production on other things?
No, I can't say to a private company, you can only sell us your goods. I cannot say that legally. I can ask them gratuitously and graciously, but they're business people, and this is now one of the hot products, right? We saw the price gouging on hand sanitizer and those things. A ventilator can be $20,000, $30,000 without the premium.
Governor Dr. Zucker, can you talk a little bit more about how you came up with the 45-day estimate, what experts you talked to, how you got to those numbers?
You want to try that?
Sure. So there are individuals who actually do modeling to look at this. There are public health experts, scientists, epidemiologists who study this, and we had two groups look at this, and they came up with a similar answer on that. And we're going to sit down and look at that a little bit closer, because this was in the course of the past week that we've asked them to give us some of those numbers. We also looked at what has happened, as the governor mentioned, in China and in Italy and South Korea, and that helps us guide the assessment that they make as well.
It is always a function of the growth curve, right? When you go sit with these statisticians, they put up China, South Korea, Italy, European countries. You look at the growth curve, and it's a curve. And the curve hits an apex. And the question is, when and how high is the apex? And that depends on what you did. How many tests did you take? How many people did you get in isolation? How much did you reduce density? Right now, the curve and the apex is at a point that is unsustainable for our healthcare system. Hence, more efforts to reduce the curve, reduce the spread, more efforts to dramatically increase the capacity of the healthcare system.
Ventilators, Westchester County continues to be the hot spot for the state. Is there any ability to send more ventilators to Westchester? Is there going to be enough there if there's not enough anywhere?
We will distribute the equipment according to the need. So if the need is in Westchester County, that's where we'll move. If the need is in New York City, that's where we'll move. The problem is on the numbers right now. You don't have enough equipment, or forget equipment, you don't have enough hospital beds to meet the need statewide.
So on the number of hospital beds, you said 53,000, but you're going to need 55,000 to 110,000?
Yes.
Why such a large range, and how are you going to come up with all those beds?
That's
What is our capacity right now? Is it 53?
That's
or
what
is it
we have been
in that
talking
ballpark?
about for that's been the issue for 3 weeks. Here are the numbers. We have 53,000 beds, 3,000 ICU beds. Right now, we're at a hospitalization rate of 15 to 19%. Today, we're at a hospitalization of 20%. So you take our 10,000 cases. How many cases today?
We had 1,100 positive, 1,700 positive.
1,700 positive. You take our 1,700 positive, they're running at a rate of 20% hospitalization today. We have 19 million people.
Sorry, that's not today, that's overall.
Overall. The expected peak is somewhere between 55 and 110. The low range, 55 is 100, is a problem because we have people now in all those 53,000 or 80% of the 53,000 hospital beds. It's not like they're vacant. 110,000 is a problem because it's double your capacity if every bed was empty. And the real problem is the ICU beds, because that's what people are going to need, because they're going to come in acutely ill, and they're going to need to be intubated, and you can't do that without an ICU bed, and you can't do that without a ventilator, and that gets back to Joseph's questions, because the ventilators are scarce already.
Floors in hospitals that could handle ICU patients that you guys could be looking at.
Yes.
And are you doing that?
The meeting today that I mentioned with, that Mike Dowling and Ken Rasky are doing, Dr. Zucker and I are going to appear by video, is saying to the hospital administrators, forget the Department of Health regulations, what's the maximum number of people you can get in your facility?
What about nurses and doctors? Will they have to be specifically trained then to handle those patients? Can they handle that?
Well, first, we need more nurses and doctors, and as I said, we're going back to the retired nurses and doctors. We're going to medical schools. We're going to nursing schools to increase that supply. DOH has waived certain certifications for nurses and doctors, so we have available personnel.
Considering you're saying this is going to peak in 45 days, should parents, businesses, et cetera, expect that school closures, et cetera, continue beyond this 2 to 5 week period? Should businesses start to anticipate that they will be closed for 45 days?
Jesse, these are projections. I deal with projections because that's what the science and the data says. But there's always a little grain of salt in there that anything could happen. But these are the projections now. We're doing schools 2 weeks at a time. And that was, some school districts wanted to do 1 week, some school districts wanted to do 4 weeks. I spoke with them. I said, look, we need a uniform period of time, because the New York Times is operating a business. It can't be that some employees have a child in this school and they can't come to work, but in another school district they can. So uniformity is important. We're doing it in 2-week intervals. 45 days, if you want to say, well, is it a safe assumption to say we're going to have a number of 2-week intervals? That's probably a safe assumption, unless it changes.
Please comment on what to your request for the Army Corps of Engineers when you talked to them today?
We spoke about the entirety of the federal response. I told him what I was looking for. He said that he wanted to be as cooperative as possible. I have been speaking with members of his team, again, late last night, early this morning. I believe I believe him when he said he will be as cooperative as possible. I believe him when he said he's aware of our situation and the numbers. You know, he's President of the United States. You have some states that are in a much different situation than we are, right? I'm governor of New York. I have some counties that have like one case where they think this is all much ado about nothing. And then I have Westchester in New York City. He's in the same situation. So I know he knows our situation in New York, and I believe him when he says he is fully committed to doing everything he can.
He was not committal on this specific request.
He said, I'll work with you. What do you need? I said, I need the Army Corps of Engineers and I need FEMA. And he said, okay.
Governor, could you please comment on a one-month hiatus or perhaps longer on sales tax for businesses?
Right now, our revenue projection is so bad. I haven't gotten the controller's report yet, but I believe the controller's report, the budget director was briefed, and I believe he said our revenue estimate was already $4 to $7 billion higher than what he would estimate. Remember, we did our revenue estimate before any of this. So he's saying we're $4 to $7 billion high on the revenue estimate, which means our budget, as we prepared it, is possibly overly optimistic. I'd love to say to everybody in the state, I know you're having a tough time, nobody pay any tax. I would love to do that. I've cut taxes. I cut taxes every year. But we're not in a fiscal position to do that. Rob, if you might comment on what you think.
Yeah, I mean, our revenue estimates were based on economics that were in late February. So all of those projections are now off. We've asked the controller. Those numbers are, and his estimates were actually based on his forecast prior to yesterday's sell-off. So we have to look at just liquidity, how much money we're getting in, right? We were also tied to the federal PIT date. So there's talk about that April 15th date being moved. You're talking about state sales tax. Our dates travel with them. So it really goes back to essentially the federal government will have to step in here to deal with this because we will have our own liquidity issues if we don't get some relief.
So Rob, based on that, how can you do a budget anytime soon when there's so many unanswered questions?
You'll have to do a budget that has flexibility in the budget to be able to make changes as you go, right? As we don't know how long this is going to last, as the governor has stated. Well, so we need a budget that's in place that gives us the flexibility to hold payments back, modulate things, move payments ahead of time for healthcare. So that's really the budget that you're going to need, one that has flexibility for us to be able to make changes and calibrate as we go throughout the year.
Karen, just to stay with that for a second, Karen, how do you do a budget? As Rob said, you pick a point where you believe the rest of the revenues will be. How do you pick that point? Well, we picked the point a few months ago. The Assembly picked a point, the Senate picked a point. The controller now says that point is too high, but you pick a point. That's a big decision. You do a budget based on that point, and then you say, caveat, if the revenues are below that, we have to have a built-in mechanism to adjust the expenditures, right? Do you know what I'm saying? So you pick a point, and then you have a built-in adjustment mechanism that if the revenues continue to slow, which I believe they will, that you have a self-adjustment mechanism in the budget. So you don't have to come back every 24 hours to readjust the budget. when the revenues shift. I'll take one more.
Governor, would you please comment on if the curve does not flatten and if these cases continue to rise, would you consider domestic travel bans between states? Is that something that you would put on the table if the curve does not flatten?
Look, we have the highest number of cases in the country. I don't think a lot of people would be coming this way. So I don't think that's going to be relevant. Look, it's a difficult situation, but we're going to get through it. And again, the people who we are worried about, it's my mother, senior citizens, compromised immune system, underlying illness, and making sure we have the hospital beds for them. That's what this is all about. And we have to keep that in focus. The reason it's so important is it's my mother, it's your mother, it's your sister, it's your cousin, it's your father. These are the people who raised us. These are the people who built this society. And we honor them with every cell in our body. And we're going to do everything we can do to make sure they're here with us this Christmas and this Hanukkah and this Kwanzaa and next Christmas and next Hanukkah and next Kwanzaa. So we're going to break our rear end to make sure our healthcare system is there for them, whatever we have to do. Last point is this. Keep it all in focus. Keep it all in focus. There was a gentleman who used to be here, who used to come through that back door, wheel himself through this room, get behind the desk, dealt with every hardship, raised himself up from a wheelchair every time he had to speak. Franklin Delano Roosevelt. He said most things better than anyone has said them since. And he said, paraphrased, things are going to get worse and worse before they get better and better. And the American people deserve to hear it straight from the shoulder. Tell the people the truth. Tell them the facts. And the facts are comforting. And that's my job and what I've been trying to do. These are the facts. This is the truth. I tell you the truth when it's pretty and when it's not pretty. But knowing the truth, I think, is reassuring. And as I know the truth, I tell the people of the state the truth. And that's the first step. And then we do what we have to do. And we will. Thank you, and God bless you.
All right, you've been listening to Governor Cuomo. They're speaking for about the last hour, referencing FDR there at the end of this latest press conference. Basically, what he did go on to say early on in this press conference was that he takes full responsibility. If you've got a problem with the quarantines, the restaurants being closed, the schools being closed, whatever the case may be, don't go to your local town supervisor, your local mayor, local representative. The full responsibility, the full weight of this, these decisions falls on Governor Cuomo, and he was quick to point that out at the beginning of this press conference. Couple of bullet points I just want to get to right now. Let's quickly just review some of the numbers right now as they have been updated as far as testing positive right now. Right now, New York State leads the nation with 1,374 positive tests, 644 of those in New York City, 380 in Westchester. Some new positive tests now that we can report, 432. The death toll is now at 12. The hospital rate is about 264 of the 1,374, and that is 19%. And that's what the governor is basically trying to talk about as far as flattening that curve, that reference you keep hearing about the curve of positive tests and hospitalizations. Got to flatten that curve because the healthcare system, of course, would be compromised if that curve continues to rise. Thus, all of these measures that have been taken over the last 28 to 48 hours. Also, drive-through testing. The governor talking about drive-through stations being assembled in Nassau County, Suffolk County, Staten Island, and Rockland County, and they're going to start rolling those out in the next few days. But testing being ramped up, that was one of the key provisions mentioned early on in this press conference. We are waiting for President Trump to speak with the coronavirus task force. That's supposed to be coming up at the bottom of the hour in about 13 minutes or so. We will, of course, break back into our programming at that point to bring you the president and the rest of the task force to get an update nationally on where we stand right now. But the governor did also mention this is probably about a 45-day model. A number of the schools and whatnot have been closed for the next 2 weeks, sometimes longer, depending on where you you are in the tri-state area. I know here in New York City, the public school closures are set to last a bit longer. But this is about a 45-day model that they're going to be looking at to see exactly where we stand in the cases and if we can, again, flatten that curve. So it's something to be on the lookout for as we continue to bring these press conferences hour by hour here on CBS New York. I'm Chris Wragge here in the CBSN New York studios. We're going to get you back to regularly scheduled programming, but be on the lookout for President Trump and the coronavirus task force to come back and break into programming in about 10 to 12 minutes.
This has been breaking news.